Thank you for joining myself and Ally Health for today's webinar. I see a lot of new names on, so I wanted to get started with introducing URL Insurance Group. We're a general agency located in Harrisburg, Pennsylvania. You can see the different products and carriers that we work with on our website, which is urlinsgroup.com. We have departments for annuities, employee benefits, health plans, life markets, and Medicare offerings. Today's webinar is on Ally Health's bundled product of telemedicine, medical bill negotiation, and discount health services. We have Doug Edwards to go over the benefits of offering this program to your small groups.
Thank you, Jess. I'm really happy to be here today and excited to speak to everybody about telemedicine. It's a really exciting, new for especially in the small group space. There's still a lot of small groups that don't have this product, and it's a really nice differentiating value-add product. So, it's been great working with URL Insurance and a lot of the agents like yourselves that are on the call today. So we hope to get you excited about this and help you understand how you can use it to grow your book of business. We're going to talk a little bit about some unique approaches to the way Ally Health markets this product that'll be differentiating for you. Make sure that we leave with a good understanding about the pricing and the commission policy, and finish off with some pretty clear next steps so that you can get started as quickly as possible offering this to some of your client base. So I just wanted to start on slide 3 here with a nice telemedicine overview. I would imagine that many on the call today are familiar with telemedicine, but just for the benefit of those that it might be a new concept to, it's basically 24/7, 365 access to a doctor. It's really convenient. You can use, the phone, the mobile app. You can use your computer, video, or voice, and you can use it for a lot of really, simple, common conditions. Bronchitis, allergies, anything that needs an antibiotic, like an ear infection, a throat infection, urinary infection. A lot of the common, ailments that we all suffer from in our day-to-day lives that, really aren't quite, don't necessarily require a visit to the doctor, especially not a visit to the urgent care center or emergency room. There's still way too many times in this country that people go to the emergency room for common, low acuity conditions like these. And that's fundamentally the gap in the market that telemedicine's really focused on addressing at this point in time. So if we switch over to the next slide here, there's just a couple really nice high-level overview, statistics about telemedicine. There's 44 states that have actively passed regulations to allow telemedicine, and there's actually only one state that has legislation directly opposed to telemedicine at this point in time. So every time we do this presentation, those numbers seem to tick up, and we're very, very close to being able to say at this point that all 50 states, are open for business for telemedicine, which is really exciting. Arkansas is that one exception at this point in time, and I have a slide later here that'll talk a little bit more about that. When you think of your smartphone, I think it's important to think about, the timing of telemedicine in the marketplace, and it does coincide heavily with the emergence of the smartphone. And not just the introduction of it to the market, but in today's day and age, 4 out of 5 people have a smartphone in the United States, and it's just really opens up the possibilities with mobile apps, with just the untethered access that we all have, to the internet, to be able to have a really great solution like telemedicine for minor health conditions. And the real market opportunities, that $38 billion wasted in the top left of this slide. That's what it costs our country for ER visits that are deemed unnecessary or overused every year. It's a huge problem. It costs the businesses that we work with a lot of money. It costs insurance companies a lot of money, and that's why the business community especially has really embraced telemedicine, because it's such an obvious solution to such an important problem. And so the best thing about offering this product, when you go out and talk to all the relationships that you have as an agent out there, you're bringing them something that's going to make sense, that they're going to, understand and appreciate the value of. So it's a really great product to be selling today. Now this next slide here, like I said, coming up is a nice overview of the United States, showing each state and an update on where the telemedicine legislation is. And like I said, a couple of years ago there was a couple states that were red. There was a few more yellows on there. Texas is now the only state that's limiting it to phone only, and Idaho is the only state that's left that's limiting it to video only, and Arkansas is the only state that actually has legislation going against allowing telemedicine to be done across the country. So it's really exciting. I mean, this is a major achievement, and it's a real testament to how much this technology and this solution is being embraced across our country. So just a couple use cases here on this next slide. It's always great when you're talking with somebody that has kids. They are very quick to identify usually a relatively recent occasion where maybe they had to take off work themselves because their child was sick for something that is really minor that maybe they could have either resolved more quickly or been able to avoid a missed work day if there was a more convenient and quick way to get an antibiotic for their child. Or myself, business traveler, I do that on a regular basis. And just as recently as a couple months ago, I used it on a business trip between meetings, and I wasn't near home, and I was able to get an antibiotic for a sore throat, which really saved me big time on that trip. So it's these little use cases that I think we can all relate to in our day-to-day lives, our families, our employees, our coworkers. You can just relate to some very real stories like this, and I think it's important when you sell telemedicine to focus on these, because this is what really makes it relatable. This is what's going to help your client really understand how important telemedicine can be as part of their employee benefit strategy. So in this next slide, just an expanded list of medical conditions that you can have addressed with telemedicine. And again, these are really just examples, and there's some of the more common conditions. But the essential common theme through a lot of these, it's antibiotic related or other very minor medications. You're not going to get any heavy narcotics prescribed through telemedicine. If you call in for anything like chest pains, or if you try to get a prescription for some kind of a chronic condition, you're going to be turned down. It's very conservatively practiced. The physicians are very experienced. They're really focused on if it's not some of these low acuity conditions like here on this slide, they'll make sure that patient is directed to the proper care center, usually the emergency room if it's something urgent, or to their provider, their specialist if it's a chronic condition. But still, there's just a huge percentage of the medical office visits in this country that do fall within the conditions that you see on the screen here, and it's a really big economic opportunity to be able to address these. So just a few things about our provider network here on this next slide. Our providers are on average 15 years of experience practicing medicine. So they're all MDs. This is not a nurse call center. This is we're actually, it says more than 800. We're actually at 1,000 now. Physicians practicing across the United States with over 2,300 licenses. So the average provider has a license in just over a couple states. The licenses are really important because it really expands the coverage of the network. Because of the ability to write prescriptions through this platform, any patient that calls in to use our service will only be shown doctors that are available, that are licensed in the state that the patient's calling from. If the patient travels, let's say, from the state of Pennsylvania to the state of New York, and they call or use the computer or use the mobile app, it'll actually locate that they're now in New York State, and it'll change the list of providers that they would see available to them. What this lets them do is then get a prescription filled local to wherever they are, which a doctor licensed in another state could not do for them. So the flexibility of having that many physicians with that many licenses across the country just really leads to low wait times and a lot of coverage and a whole lot of patient satisfaction. And we actually talk about that a little bit on the next slide. Our callback times are under 10 minutes. So when you either open the mobile app and request a physician, or you call into the call center and request a consult, you're going to get a call back on average in under 10 minutes. Now, that's an average, so if it's 13 minutes, that's not unreasonable, but it's also sometimes as quick as 2 or 3 minutes, depending on how quickly a doctor's available. But we're always adding doctors to the network as demand calls for. The doctors love it. They don't have paperwork. They don't have to deal with insurance companies. So many of the doctors in the network, tell us how nice it is to be able to just, practice medicine, which is what they signed up for when they went to school. And it's just the unfortunate reality of being a doctor is you have to do a whole lot of stuff other than practice medicine if you're, running a family practice. So they really enjoy this. And a lot of these doctors are family practice physicians that mix doing these telemedicine consults in with their, regular patient load. And also a large number of them are emergency room doctors that, do this because they have to have a few days off because they work long shifts. So really good diverse network, a lot of experience. And the way we offer it is zero cost per use. So everything's sold on a fixed PEPM basis. So how does it work? That's probably the most important question that we get asked. And we've got some really great technology. We've got a mobile app that's very user-friendly, a website that works in a very similar fashion. So as a user, they feel like a similar platform when you're using them, which is very important. Both of those platforms let you actually see the doctors that are available, their name, their face, where they went to school, their credentials, little bit of their background. Very easy to look them up on health grades to make sure that that it hits home that you're going to be speaking to a doctor that's somewhere in your state, that's got a lot of experience, that you can have a high degree of confidence in. And we get just a lot of great feedback about that. So we always encourage our members to use the video conference or mobile app, but we're also thrilled to take calls in, just by telephone. We still get a very, very large percentage of our calls that do come in through the telephone. And whatever's most convenient for the member at the end of the day is how we want them to use the service. So here's just a screenshot on this next slide about selecting your doctor. So you see here on the top it says find a doctor. This is just a good typical view of the web application. The mobile app looks very similar, just formatted for the smaller screen. And again, like I was just talking about, you can see the doctors that are available. You can just choose which one you want to visit. You can choose the first option at the top, which is who the doctor is on call. So there's just a lot of really good ways to use this service from an accessibility standpoint. So the next is a actual screenshot of a physician profile. This is Dr. Deborah Mulligan. This is one of our real doctors, and just like I was describing, you can see a little bit about her, where she went to school. The next tab over is more about her credentials and finally her availability, which I'm going to show on this next slide here, this book your appointment. So if this doctor in this screenshot is available for a video consult right now, if you were to select that visit now button. But for many of us that might have a lunch break or whatever time in the workday is more convenient, you can see how easy it is here to just choose a different time slot, and it saves right to your calendar on your phone. It's for those of you that are familiar with the restaurant app OpenTable. This is, I always say this is like OpenTable for doctors. Very, very user friendly. Here's a quick screenshot of the mobile app. A little illustration of what it's like doing a video chat with a doctor. Very similar to FaceTime on your mobile phone. So it's already an experience that a lot of people are familiar with. The doctors, again, find that they're able to do a really good job, providing care to the patient through this platform. And again, we get a lot of really good user feedback on it. So here's a slide on the continuity of care. This is probably, when we sell to small groups or medium groups, this is probably one of the most important questions that we get asked from the HR director or whoever the group administrator might be with that group, is how does this tie into the primary care physician? Like, what's the continuity of care with this service? And there's a couple really important things to talk about here. Number one, we're not trying to replace the primary care physician. We're trying to complement that. It's incredibly easy to forward records of any consults that the patient does. They can just log right in, a couple button clicks, and they can forward any transcripts of any visits they've had right into their primary care physician. They can save their primary care physician's contact information right in their portal. And also, it's very easy to follow up with questions through a secure messaging service that's built into the portal and the mobile app. If you have any follow-up questions with the physician that provided you service, it's really, really easy to just open up the app, open up the portal, type in your follow-up questions. It's completely secure. They get back to you very quickly, and it's actually something that I've used myself and thought it was amazing. I didn't have to call back into the 800 number again, try to get rerouted to the same physician. It was very, very easy to get connected back to the physician that had provided me care. So here on this next slide, advantages for employers. This really hits home with maybe some of the medium businesses that you might work with, where they're either self-funded or they're fully experience rated. This is a real important illustration, is that Ally Health is replacing unnecessary ER visits, urgent care visits, and primary care physician visits. And there's a major economic value to avoiding those unnecessary visits. Ally Health consults are $0 per consult. There's a fixed monthly per member per month charge to be an Ally Health member. It covers your family, but you get unlimited 0 consults once you're a member. And so, it doesn't take many avoided visits for the service to pay for itself, and potentially a lot more. Most of our self-funded groups that we work with, this service more than pays for itself, which is a really, really exciting thing to understand, because it means you can really sell this not as something that they need to assign extra budget to, but you can sell this as something that's going to ultimately lower their costs. And so, the other advantage for employer, shown on this next slide here, advantages for employers, there's a monetary value, and there's just an important factor that businesses place on their productivity. Getting their employees back to work faster, avoiding them from missing work in the first place, keeping them healthier and more engaged in their jobs is really, really important. It's one of the most important things that business owners worry about and care about. And telemedicine pays for itself because of the avoided unnecessary visits to the doctor. But then these productivity improvements just, really it's like icing on the cake. I mean, it's a hard thing to put a real hard dollar value on, but you don't really have to, because there hasn't been a business owner that we've talked about this with that doesn't quickly acknowledge and recognize how important this is for them. And then finally, there's an element to just being a happier employee. I mean, there's the whole reason why companies provide good benefits and compete for good employees by providing benefits. This is such an inexpensive offering that's a real value add to their employee benefit plan. For just a few dollars a month that you can add for each employee, you can really enhance your plan, and obviously that results in employee retention, happier employees, and should be a little bit of a recruiting benefit as well. Now, on this slide, most telemedicine companies, this is kind of comparing how Ally Health does business compared to what the rest of the industry does. So most of the industry charges per consult, and for a variety of reasons, we feel extremely passionate that that's the wrong model. The cost per consult ends up discouraging utilization. It provides a reason for people ultimately to not try to use this service, and that's the worst thing you want to do for something like this where you're trying to encourage people to give it a try, because after they give it a try, if they have a good experience, they're going to try it again. We've switched over many groups from competitors, and what we often find is that the adoption is extremely low with these groups that we take over, and we're able to double or triple their utilization and their adoption with our model. And there's a couple reasons for that. You know, some of the valid uses of telemedicine, maybe you just want to ask a question for a doctor. Maybe you're not sure if that's going to ultimately avoid you having to go to the emergency room or go to the urgent care clinic on the weekend. And, you know, maybe you call and the doctor, you know, isn't able to help you and you still go. We want our members to feel like that was still a valid use of our service and to still feel good about it. With all of our competitors, they would still pay for that consult and then have to go to the primary care physician anyway. That leads to very frustrated members that may not try this again. And we feel that in order for telemedicine to be conservative and done properly, those consults that result in a recommendation that you do need to go see a doctor in person, that needs to be okay. That needs to be an important part of this service. So that's really the whole point here. We want to minimize barriers. We want to encourage people to try it. And, you know, we find that our model results in much higher utilization, much better rates of early adoption when we roll it out. People are just more comfortable trying it. They don't feel as much pressure about giving it a try, and we tend to outperform on the ROI delivered by a wide margin. And so this next slide talks a little bit more about utilization and how it's the key to ROI and value. You know, just following up on the prior slide there. So, you know, everything we do is really trying to drive utilization. So our cost structure with the fixed per member per month and the $0 unlimited consult is one big part of how we drive utilization. But beyond that, we actually have a dedicated account management process that really is the #1 focus of our business. You know, it takes a lot of work to get new customers. The last thing we want to do at Ally Health is ever lose a customer. We want them for life, and we know that if we're providing value to them, they're going to stay with us, and we know that if we can encourage the employees to use the service, they're going to get that value. So we do just a tremendous amount of marketing after the sale, after a member signs up, just educating them, reminding them about how to access it, case studies about people that have used it and how it worked for them, a lot of testimonials. So we really just try to you know, keep being proactive and repetitive in the message about what telemedicine can do for them. We do a lot of raffles, you know, other special contests with incentives. And again, it's all really trying to do this one core goal, which is drive utilization of this service. So on this keys to engagement slide, you know, really talks a little bit more about some of these engagement campaigns that I just started to highlight. You know, there's a really, you know, we start out with a 12-month communication campaign, and we'll actually design this with the group administrator for each group. So we'll work with them. We'll do a really nice pre-launch call with them, talk about some of the tools we have available, some of the best practices from other groups that we work with, and ultimately, though, we make sure that we customize it per their preferences. And if you go to the next slide here, you can, which is, you know, different for every group, but this is just a really nice example of the kind of custom engagement plan that we'll put together over a 12-month calendar year for every new group. And, you know, the group administrators really like this. This helps them feel like they're part of really, you know, promoting this. We find that it builds a lot of loyalty. We find that it does really drive utilization. And it really also leads to member satisfaction because, you know, people don't always get sick in the first month that this is necessarily, you know, launched as a new benefit. So you really got to stay consistent with communicating about this. This is a little bit of a paradigm shift to be able to use healthcare in this manner. And, you know, not every employer group is going to have all 20-somethings in terms of being, you know, very tech-friendly, you know, younger audience. So we have very, you know, mixed age groups and very mixed, you know, in terms of technical competency. So we really got to make sure that we we have something for everybody, that everybody feels comfortable giving this service a try. So here's a example of our membership letter on this next slide. So it's a double-sided letter. Every member gets this when they sign up. We time the mailing of these to be as close as possible to their first day of being an active member with us. And Jess at the introduction talked a little bit about how we do include a prescription discount card service with our membership, and we also include a medical bill negotiation perk as well, which is a service that can act on your behalf to help you save money on large medical bills. So both of those are highlighted in this as well as, of course, primarily the telemedicine service. So there's really nice instructions on how to use it. You can cut out the card and either, put it up on your bulletin board, keep it in your wallet, but we try to just have it so that, people can, remember on how to access the service and have really clear instructions on how to do that. Here on this next slide are quarterly client reports. These are really important. So this is part of that engagement campaign and that 12-month, first-year calendar that we talked about with all new groups. We do quarterly client reports that actually share back in a very transparent way with the group how many of their members have, filled out their health history and created their password and done that, 5-minute initial setup of their account. How many have actually used a consult? And, what were the survey results? We can't communicate back any information that violates HIPAA, but we can communicate, population statistics like, 10 of your employees used the service in the last quarter. 9 of them said their issue was resolved. 3 of those 9 said they would have gone to the emergency room if they didn't have this service. 4 of them said they would have used the urgent care, and the other 2 said they would have used their primary care physician. So this is very meaningful information to share back with the business owner or the HR department. It really helps them, feel like they're getting tangible value from this service, understanding, what that is. So very, very important. And again, this is, we consider this an essential part of our service. So here's a slide on pricing and commissions. We're going to start with just our plans and pricing. As I've said earlier in this presentation, everything's sold on a per employee per month basis. It does cover the employee and their dependents. A couple of things on their dependents. These are questions we get asked on a regular basis. Their dependents are any household dependents, including elderly parents that are living with them, if that's the same address, or children up to age 26 that may be away at college or have already moved out. It's a very flexible dependent policy, and again, that's something that we get a lot of positive reaction to, because I know the insurance companies in particular are usually very, very strict about these policies, and we try to be a little bit more flexible about them. When you are a member, you and your dependents have unlimited $0 copay consults through our service, and obviously the costs for our account management team to do the marketing required to drive adoption and utilization is all included in that per employee per month cost. And all of our contracts can be canceled within 30 days. So we do this because we feel that it's our job to provide value, to provide a service that's appreciated, that's saving money. We want our clients to know on a regular basis in a very transparent fashion, what value they are getting from us. And we just feel like this way of doing business aligns us with our clients. They love it. We've got a really low churn rate, really high retention rate. And that tells us that this is something that we definitely want to continue and promote, and it's just a core part of how we do business. So on this next slide, for plans and pricing, it goes into our tiering. So for group paid accounts, for 3 to 50 members, it's $850 PEPM with a setup fee. For 51, I should say 51 to 250 members, it goes down to $5 per employee per month. And when it's over 250, it's $450 per employee per month. And we definitely encourage you, anything over 1,000, to call us, and not only for custom pricing, but the groups tend to get a little bit more specialized as they get larger like that, and our salespeople will just want to work with you to make sure we do everything we can to increase your odds of winning the business and being, competitive and have it structured the right way so that it's complementary to their health plan. So over 1,000, do make sure you call us. Then we do support voluntary enrollment. That's something that I know a lot of our competition doesn't do. We are thrilled to have it. It's very popular. It's a big part of our business. And this is the one exception to the per employee per month. That $250 is per employee per week. The W's for week. We do that obviously because we don't know if they're going to be on a weekly, biweekly, or whatever payroll cycle they may have. So that quote is as a weekly payroll deduct cost, and that is after tax. I will note that payroll deduct, we can't do a setup fee for payroll deduct. It's got to be even payments. So that setup fee is essentially worked into that per employee per week cost. And if you needed a monthly equivalent to compare the voluntary enrollment, the $250 per employee per week equates to $1083 per month. And then we have a direct billing option. You can actually enroll them right through our website or through a one-page form that we have, and that's just credit card billing on a monthly recurring basis. And then finally, we have our commission policy. So for everybody we work with, Ally Health only works through partners, which are all insurance agents and brokers, and we pay 20% commissions. But URL is a really important partner of ours. We've worked with them for some time now, and they negotiated on behalf of all of you guys a higher commission than we give for anybody else. And in order to get that commission, you have to sign up through this link right here, which is a link that's earmarked for URL. So we'll know that that you've come in through this webinar, through your relationship with URL Insurance, and we'll make sure that you're set up with the 25% commission. And again, these commission rates recur every month as long as we keep the customer. They don't go down after year one. And the way we look at it is we're happy to have that customer in month 16 or month 60, just like we were in month 2. So as long as they're happy and stay with us, you're going to continue to get commissions. So you're really giving yourself a raise with every sale you make with us. And, it's a really nice way to set up residual income for yourself. So how to sign up? Again, I'm just repeating the link that I showed you a couple slides ago. This is a screenshot of what that looks like, and it probably takes 3 to 4 minutes to sign up. It's literally just your basic contact information. There's a quick place for you to digitally sign that you want to be a new agent, and you get the opportunity to have a free trial account if you'd like, just for yourself, so that you can give the service a try and vouch for it, and maybe have a personal story or two that you can use when you talk to your clients about this. You'll get your agent number set up. A copy of your agreement will be sent to you by email, and one of our salespeople will reach out to you after you sign up just to do some more introductory training. Make sure you have the flyers and enrollment forms you need, and custom proposal materials, really whatever they can do to help enable you to be successful. So next slide here about the signing up process. So again, you're just going to create your password as well as part of this process so that you can access our sales tools online. And I mentioned the free trial, that the agent number will be assigned to you. So it's really, a lot happens there in just a few minutes. It's well worth your time, and we definitely appreciate you doing it. The one thing that's important is we do need you to return your W-9 form and direct deposit form for commissions back to us after you get that email. So that's your major to do after you get the confirmation email from us. So a little bit about our sales tools. I mentioned that a few times on this webinar so far. Here's a screenshot of them, and all you have to do to find this is just go to allyhealth.net. You can see our website right here. And those 3 buttons at the top are the 3 that you got to remember. The one all the way on the right that says Toolbox is the one you want, and it's for our agents. And you log in, and if it's easy to reset your password if you forget. Your username is always your email. And there's recorded webinars, there's marketing materials for print, there's marketing materials for order, other marketing stuff like pens and different fun handouts that have the ALLYHEALTH branding. So just little things that you guys can use in your efforts working with your clients to promote this. There's a tab that lets you request a proposal on an opportunity, request sales support on an opportunity, and then there's a new customer enrollment, which is all three types of enrollment: direct billing for individuals, voluntary for groups, and group paid, all through the sales tools here. And then there's also any kind of presentation that you might need, and there's also a really great FAQ knowledge base: billing questions, commission questions, questions about the doctors, the network. Our focus there with that knowledge base is, anytime we get a good question that's not addressed in there, we make sure we add it to it with a good answer. Again, this is something we get a lot of really great feedback about. We know that this is something new for you. When you go out, you have your first couple meetings with your clients where you might introduce this. It's inevitable you're going to get a question or two that you didn't think of or didn't maybe hear covered on this webinar. We want to know that between the other webinars recorded on our website, the flyers, the knowledge base, that you can really have a great resource to quickly get answers, and our contact information is all over it as well. So we're thrilled to get a phone call or an email and help you, do what we can to win the business. So on this next slide here, 35, the next steps. So again, here's the URL that insurance link that you need to click. This is what's going to get you your 25% commission when you sign up. And when you do, we're going to reach out to you. Got to return the W-9 to us and the direct deposit form. And we really look forward to working with you. We'll do a platform demo if you'd like once you sign up and reach out to us. We'll answer whatever questions you have. We're happy to talk about any cases that you might have in mind already. Really, we're here to help you be successful with this. All of the agents that we work with that have the most success with this really, don't just use it to sell telemedicine, but they use telemedicine to sell all the other products that they have to offer. Because telemedicine's exciting, it's interesting, it's got a really, nice story that it pays for itself. You should be using this to open new doors, to go back to existing clients and establish, your value and your expertise. And, we're thrilled to work with you in that capacity. So with that, I just wanted to say thank you. And if there's time for any questions, I'm happy to take any.
There's a box if nobody's seen it, on the bottom of your right-hand screen. There should be a box there. You can enter any questions in. We actually do have one right now. It's asking if there's a minimum employee participation for the voluntary program.
For the voluntary program, the minimum is 3. If it's only 1 or 2, we would just encourage them to use the credit card individual sign-up.
There's another one. It's $3.95 the setup fee per employee per month.
The setup fee is a one-time setup fee, so it gets included in the first invoice, and it basically includes the budget for us to get them set up, mail out the welcome letter, and support the little bit of a heavier involvement we do have in the first month with the pre-launch planning and everything we got to do to get a group launched.
Well, I think that's it right now. But feel free to reach out to either one of us if you do run into any questions. And again, my name is Jessica, and I'm at 800-926-8875, extension 123. Thank you for joining us today, and thank you, Doug.
All right. Thanks, Jess. Thanks, everybody. Look forward to talking with you.